Hello, welcome to Optimizing GPMPs and TCAs for improved patient outcomes. Now, my name is Magali De Castro and I am a nurse educator and primary care consultant, and I will be presenting this session for you today. So let's get started. What are we covering today? So in this session, we'll be going over the Audit-Proof care plan. So this is what are the Medicare requirements for GP management plans, or GPMPs, and team care arrangements, or TCAs as they're called. We'll also be looking at the most effective templates to easily create meaningful care plans, and the key word there being meaningful. A lot of the times we can get into a habit of just churning through care plans in a very automated way, and we sort of forget what the aim of the whole exercise really is. We're also going to have a look at how to simplify referral paperwork and how to improve communication with allied health providers. We will chat about how to set up an effective system to recruit and engage patients. One of the things that we hear a lot is that it's difficult to get patients to come back for a review, and that could be for a couple of reasons, which we'll go into in considerable detail. We're also going to have a look at how to use care plans to really improve a patient's quality of life. As I said before, the key aim here is to look at meaningful care planning. So not just something that's effective and efficient for us as providers to put in place, but also something that's meaningful to the patient. All right, why care plans? Why would Medicare put all this money into chronic disease management plans? So if we have a quick look at our budget expenditure for health, around $25.5 billion, or that's 48% of the allocated health expenditure for a year in Australia, is roughly allocated to chronic diseases. So not only do we have a huge burden of chronic disease and an increasing burden of chronic disease, but we also know that we have an aging population, and with that comes more chronic disease. One of the things is we know that we're living longer, but we're not necessarily living healthier. So what this translates into is the new normal that we're seeing coming up more increasingly is the complex multi-morbid patients. So patients who not only have just one condition, a clean cut diabetes, but they're coming in with a whole series of issues. And when we're looking at this type of patient, it's not as simple as just looking at, well, what's the best practice for each one of the individual conditions, and away we go. It's really looking at function and looking at the patient more holistically. So a heck of a lot of money spent on chronic diseases, and the impact obviously on chronic diseases. And the big aim of care planning or GP management plans is really to provide a vehicle for general practice, to essentially fund general practice, to be able to provide some comprehensive management for patients with chronic conditions. Now, what are some of the challenges? Because that sounds all well and good in theory, but it hasn't translated into practice all that smoothly. Now, some of the challenges we face, at least for GPs, is the fact that there's more paperwork involved. And when I say GPs, I mean general practice. So it's not just the GPs, but the GPs, nurses, the whole practice team. There's more paperwork involved. The process is quite complex, and I will break it down. So we will go through all the different steps and the Medicare items and how all of that comes together. But overall, it can be an overwhelming process. The eligibility criteria and the referral criteria for allied health professionals can be confusing for both patients and for providers. It's a time-consuming process, and a lot of times providers are not quite sure what services to refer to or don't know what's available in the local area. Now, in terms of what the challenges that allied health providers face, because allied health providers face as many barriers and challenges as we do on the general practice side, and it's no less complicated and convoluted a process for them on their end as well. So some of their challenges, again, same as general practice, more paperwork. The rebate that they get is actually quite low, and for a lot of disciplines, is actually not enough to provide a viable consultation. So in many instances, providers are actually losing money by bulk billing services under the Medicare allied health professional sessions. The other challenge is there's not enough sessions for adequate treatment. So not only do we only get 5 sessions in a year, in a calendar year, and we'll go into this in detail, but a lot of times those 5 sessions are not enough to, especially when we have a patient who's already quite complex, as is the case with a lot of the patients that we're going to put on GP management plans. But also a lot of times a provider won't even get those 5 because the 5 sessions will be divided between multiple allied health services. So it's really a barrier, and it means that if you need additional sessions, then the patient has to pay for those out of pocket. So they actually have to pay for those privately if they go over the 5.